Good afternoon and welcome to today's presentation titled Friday Health Plans Look to a Cooperative Effort to Improve Member Health, brought to you by MedeAnalytics with special guests Friday Health Plans and UST HealthProof. Before we turn things over, I'd like to go over a few housekeeping items. A recording of the session will be available for replay and sent out to the attendees. All attendees will be on mute for the entirety of the webinar. If you have a question, please submit them via the Q&A text box to the right of the screen at any time. We will address them during the question and answer portion if time allows. I'd like to now take a moment and introduce our presenters. First up, please welcome Kevin Adams, who serves as CEO at UST HealthProof. Kevin has over 25 years of experience delivering business solutions for investment banking, healthcare, and public sectors. At UST, Kevin leads a team of industry experts that help healthcare institutions evolve and be more innovative, agile, and customer-centric by identifying business opportunities and guiding them throughout the process. Next, please meet Sal Gentili, CEO and co-founder of Friday Health Plans. Sal founded Friday Health Plans with the goal to transform the health insurance market. With more than 30 years of experience in high-growth, innovative companies, Sal brings a deep expertise of operational leadership, market strategy, and business development. Prior to founding Friday, Sal was CEO of HealthX, a software company which built online portals and tools for the health insurance industry. He's an expert at using technology to drive efficiency and automation, as well as leading sales, marketing, and business development functions at many high-growth technology firms. Thank you, Sal. Finally, please meet Andrea Sorensen, Associate Vice President of Product Consulting here at MedeAnalytics. She holds over 25 years of experience working within the health insurance industry and has lived in the shoes of our customers by serving in roles for both the payer and provider. As a leader here at Medi, her extensive healthcare knowledge and data management expertise has helped health plans exceed expectations through reporting and analytics on insights to areas such as actuarial and clinical, quality management, employer reporting, and provider analytics. Welcome all. During this webinar, you will learn how to leverage the power of your data to make smarter decisions to help better manage costs and ultimately better serve members. And with that, I'd like to pass it over to Kevin Adams from UST HealthProof to start today's presentation. Thank you, Kevin.
Well, thank you, Jessica. Thank you, Sal, for joining us today. I think I'll just set a little bit of the background and how we got here as just for a couple minutes here. So over the last 4 years, UST HealthProof has been driving a strategy that we think has the true opportunity to disrupt the health insurance market in the United States. We've crafted a platform approach to the core administration needs of health plans. And what's important about it is the approach that we have helps regional, community, or even national plans adopt platforms at a substantially lower cost, while at the same time still getting all of the benefits of the modern technologies that we have to offer today. And in that, we've driven for a long time through a whole variety of capabilities. And what we're here to talk about today is an important addition that we added to our platform last year with the MedeAnalytics products. At the core of this, there are two key fundamental pieces of the strategy. The first one is that the platform itself is comprised of anywhere up to 10 or 12 different unique capabilities. Capability could be a technology or capability could be a service. But the important aspect of it is that when we show up at our customer's site, it isn't about the systems integration of those capabilities. It's about the configuration of them. We've pre-integrated all of the technologies so that the technical integration pieces are not the problem anymore. It's merely figuring out how they can be configured to address the important business needs of our customers. The second part of the concept that we have is that we've built a number of tools, upwards of 50 or 60 tools, which allow for a seamless conversion from what is the legacy platform to our modern platform. And the reason I call it a platform is because it isn't one piece of technology. It isn't one company's technologies. It's made up of a number of different technologies from a number of different companies. And so the integration can be complex if you do it ad hoc. But because we've been able to do this all ahead of time, those complexities do not have to get experienced on each implementation. The final piece of the puzzle, which I think is of great benefit, is that we help operate the platform for a number of our customers. And because we're operating on a consistent platform across customers, we're able to gain the synergies and the leverage of our operation associates, claims processors, enrollment processors, across all our customers, as opposed to having to have unique instances of agents because the software or the platform is different.
Kind of use this slide as a landing page for where we first began working with MedeAnalytics, and indeed for Friday Health, which was our first customer in this area. So we were implementing most of this ecosystem, and we had held data warehousing and analytics kind of to the side because it required a significantly more complex approach that we had not yet figured out how to create. I'm not going to say it's templated, but an easier implementation approach, which was more in alignment with how we were doing the rest of the ecosystem. And after a substantial amount of conversation with the Medi team, we figured out a really great approach that we could plug the large part of their footprint capability into our ecosystem in such a way that we could make it a repeatable capability, which allows us now to plug what I think was a very sizable hole in our ecosystem, leveraging the MedeAnalytics products. Our first customer was, like I was saying, Friday Health. And if you know Sal, you know he's about finding the best capability for the best price. And thankfully, you know, based on the repeatability that Medi had and the ease of integration into our overall solution, it worked really well. And obviously Sal's going to talk a little bit about how we did that, or less about how we did it, but more about the business benefits that he achieved from that. Next slide, please. And you know, this is kind of just to conclude. You know, if you think about one word on what we do, it's about outcomes, and everything we do is meant to the outcome to be a benefit to our health plan customers. And so the implementation of the technology is always done at fixed price, meaning the outcome is you get it for the price we agreed to and the time we agreed to. And then obviously the BPAS model we have is all PMPM based. And that allows you to know from the day of signing what your platform is going to cost you to run for the entire duration of the proposition that we have presented. So with that, I'll turn it over to the really more exciting piece of this, which is the team talking about, you know, what the benefits that you can achieve from implementing the ecosystem that we have, as well as the specifically the Medi capabilities that are available to you. Sal, over to you.
Thanks, Kevin. Appreciate that. Happy to be with you all this morning. Thanks for taking the time. Maybe a little bit about Friday Health Plans. So again, I'm Sal Gentili, and I started Friday with Dave Pinkert about 6 years ago now, I guess. And you know, we've been able to achieve some success. Who we are at our core is we're a Denver-based healthcare company, but looking to grow nationally. And we're really targeting people out there who buy their own health insurance. That's primarily, you know, ACA members on and off exchange, as well as small group members. But we entered the market by acquiring a health plan that had, you know, 45 years of history in the Denver or the rural Colorado market mostly. and had lines of business in Medicare cost as well as Medicaid CHIP and commercial. And so that was the launch point for the business. And we maintain those other lines of business. So we do have a fairly diverse footprint, although our growth focus is fairly exclusively on those individuals in the commercial space who are buying their own health insurance. And we recently raised capital, expanded into 3 additional states, Texas, Nevada, and New Mexico. With the Friday brand, we grew from somewhere in the mid-teens to just about 75,000 members. So we're very happy about that. And a lot of the work we've done with the UST ecosystem enables us to get there and gives us the confidence to keep going. So what you'll hear about shortly in the press is that we've raised more capital and are planning to expand into an additional 8 states over the next 2 years. So we're really excited about that. Our primary goal, if you're going to sell health insurance to individual consumers in particular on the exchanges, you'd better know that it's a price-driven market and that, the vast majority of consumers would identify price as their number one item. And so Kevin's spot on. I'm always in market, looking for value when I'm working with partners, because we're trying to hit a value promise, which is that people can get ACA compliant plans and maybe even more robust benefits than just the minimum core set of ACA compliant benefits, and get those at a price point that doesn't offend your wallet. And that's really who we are. And you can go to the next slide, please. And so, in having that goal of being the low-cost provider, well, if you're the low-cost provider and you don't have the analytics capabilities necessary to ensure that you can make money at those premium price points, well, that's a recipe for going out of business in a hurry. I would simply point you to about 29 of the co-ops who had low price for 2 years and were out of business by year 3 or 4. And so we had to work really, really hard to figure out how we could meet our value promise and do so without driving ourselves out of business. And we appreciate the work that UST did. And, thanks to my background and from my TriZetto days, I was able to make a connection with the MedeAnalytics team and the UST team and, put together this partnership that enabled us to get really confident about, the data we had and using it effectively to ensure that we could meet our value promise without losing money. What initially, drove me to the Medi team and, enabled us to move forward was the financial analytics that the company brings out of the box. So we were able to connect Medi to our legacy claim system and then to our new health rules claim system, which had only been live for about a year when we started this effort, and pull all of that data together. We were struggling to get our IBNR accurate, and this tool, really, helped us to look at the claims data and specifically the IBNR impact on what we were going to file. As a small health plan, we're very sensitive to those kinds of data elements, and so being able to get IBNR more right was of critical importance. I can tell you in 2020 we were able to hit IBNR to within a few $100,000 on an annual basis. That is just an extraordinary performance after 1 year. What we then do is, utilizing the data, we dig in to the claims data in particular and the member data at the premium level to understand, what we're seeing and why. And we use that claim data and then the associated, product, details and who bought what to help drive the underwriting cycle for us, right? This is a continuous improvement process for us. I'll give you an example. The first year in market, we wanted to do something different. And so we offered 3 primary care visits where the ACA only required 1. We offered 3 additional. by utilizing the claim data and seeing where our members, came out on a risk-adjusted basis, we were able to enhance our product for the 2021 plan year, and we now offer an unlimited primary care benefit with a mental health parity component for people to get, their behavioral health services on an unlimited basis without any copays. We would not have been able to achieve that, product differentiation without a lot of confidence that it wasn't going to cost us materially on our MLR, and in fact might even drive down our MLR costs. We were able to share the data, with our Milliman actuaries and do a lot of work to give us the confidence that we can continue to enhance our product in keeping with our value promise of low pricing, but with a rich benefit around access and primary care. So, really valuable tool for helping us do that. And it also helps us to develop new products. When we looked, we also saw that while there are a lot of our customers who really benefit from our rich benefit design, there were some that were saying, hey, no frills is really all we need because we don't utilize the services. So we were also able to analyze, what would happen if we had, just 10 essential benefits with a standard copay and just wanted to hit the lowest possible price point in the market. And, using analytics, again, we were able to derive a no frills bronze product and put it in the market to great success in all 4 of our markets and drive, additional member benefit out of that. And I would argue that a lot of our success in the new markets this year, getting us over 70,000 individual members, was driven, largely by our ability to do these analytics and create a differentiated outcome. We can move to the next slide, please. What I would say was upside for us in terms of deriving additional benefits. I'd have been happy just with getting the benefits I spoke about in the prior slide. But by pulling in our clinical team, and I have the great, benefit of having a chief operating officer who's also a registered nurse and runs our entire clinical department for efficiency. And in working with Jen, we were able to further analyze the MedeAnalytics solution and determine that it was going to be really helpful for us in a few areas. At an operating level, our clinical staff uses the tool to help us better analyze clinical data to manage member gaps in care. And that's, as many of you know, a real critical success factor for managing MLR and driving better outcomes for our members. Use of the dashboards makes that easier for the team to use to produce provider scorecards, which is a critical function we'll talk about here. And in doing so really allows us to identify opportunities to educate our providers. Coding is critical for us for a number of reasons, but if you play in the ACA, that, the game can be won or lost on how well you perform in risk adjustment. And so getting coding right and being able to get these members accurately assessed and coded, is a critical success factor for us. The game's not over until we've risk adjusted all the members to determine how our year really went. And our clinical team is able to utilize this to have a best-in-class risk adjustment outcome, and is one of the 4 pillars of critical success for our business. We use the data to, identify where the cost drivers are in our business. Which I'll draw back to our previous slide. That cost analytics enables us to work with the clinical team to redesign the benefits. It was the clinical team that pushed us to move to an unlimited primary care benefit and also to include the mental health component. They had a strong data to support that, by getting people to utilize the mental health benefits, we could lower our ER utilization and our pain medication utilization, and we're starting to see early results from that. As I mentioned, we utilize the data to really manage our risk scoring, but more importantly, also to just get our members the right care at the right time, for success. And as you all know, all of these services really drive to better HEDIS and STARS measures. And, if you're going to play in this game, you better get really good HEDIS and STARS scores, or you're going to have, trouble hitting your financial objectives and keeping all of the regulators happy. So, look, that was a lot, but that's how we primarily use the tool. We have to be data driven. At our size, we can't afford to be average at any of the core processes that we do. And so we rely on the capability of Medi to, drive our business and to allow us to scale with the data from all of these customers we have. So hopefully that was helpful. And when we get to the Q&A part, I'm happy to answer any questions.
I think we can move on to the next slide. Good morning or afternoon, depending where everybody is out there on the webinar. My name is Andrea Sorensen. I am the AVP of Product Consulting Team here at MedeAnalytics. And as both Sal and Kevin had voiced, thanks everybody for taking the time to listen in here today. We've got some exciting stuff that's hopefully you're seeing it is happening. And what I want to do now is kind of tie it all back together and talk about MedeAnalytics and actually show you some examples of the things that Sal had mentioned in the use cases of how Friday Health Plan is using our products to get those deep data insights. Go ahead and go to the next slide. So just a couple slides here to kick off a little bit more about MedeAnalytics. We have been in the market for 25 years, specifically in the healthcare industry, and I'm going to talk a little bit more about that here in a second. We're growing as a company. I've been at Medi for 3 years, and I think, I was employee number 300 some, and so we've grown a lot in just those 3 years. And so, the signs of that is we're growing because we're meeting the right markers out in the market. We currently have 65 payer clients. We do also have products that support the provider market, but today's webinar is specifically around the payer industry. Within our data set, we have 60 million plus members, and that is continuing to grow. As we take on additional clients, that overall data set that allows us, deep insights into benchmarks, those kind of things, it continues to grow. We are high trust certified. And then, as I mentioned, we only focus in healthcare. All 25 years have been in healthcare. People on my team, for example, are industry experts that have come from the healthcare environment. I used to work at a Blues for over 20 years, and then I worked at a provider's office doing financial clinical quality reporting. And so when we work with you from a MedeAnalytics perspective, we are very healthcare focused and healthcare oriented to help make sure that we're meeting your needs. Go ahead and move to the next slide. So what sets MedeAnalytics apart? I think these 6 points are very important just to call out, and the fact that it's one platform in any user. Now what that means is from a end user perspective, it meets the needs of the C-suites, looking at high level KPIs, to those people who are managing departments and wanting to evaluate, those cost trend drivers. Is there some kind of interventions we need to put in place? And then all the way down to the end analysts who are looking at the very minute detail of the patients, what's driving those patients, what's going on with those patients. And you don't have to, if you have multiple of our products, you don't have to sign in and out of products to access new information. It's with one click of a button. You can quickly move from one to another. And I'll show you that later on when we get into the demo. It's important that we support all lines of business. Both Sal and Kevin mentioned that from, not just commercial, but the Medicare, Medicaid, all the things that are changing from the ACA world and, COVID impacts to the Medicaid market going forward. Everything that we do and the data sets that we leverage and bring into our system help support the business questions aligned with all lines of business. Actionable insights. The call out here is we have a healthcare data model that was built by Medi with our clients. Over all these years, we've gotten great feedback from our client population that identifies, what are the things that we need to focus on with them, and how do we serve up those views quickly for them, and how can then the clients get actionable insights. You're going to see as I go through the demonstration, we bring data in, we map it into our healthcare data model, and then we create dashboards that then can be drilled into all the way down to the patient level. So again, that focus back to the one platform and user, anyone can sign into this and get support on questions that they need to answer. The rapid innovation and equaling future ready. As I mentioned just a second ago, our platform has been built with a lot of feedback from our clients. We want to stay relevant in the market, but we also want to make sure that we're staying up to speed with the things that are affecting our clientele. Every quarter, our products are updated with new innovation, new capabilities, and every month our platform, which it would be more like the user interface, our platform is updated every month with new capabilities. And so we're always evolving, always moving to meet the client needs in the future. The speed to value, I hope you will see that as I get into the demo. You're going to see how you can guide yourself through leveraging some out-of-the-box views of the data, but you also have that ability to just ad hoc right off the bat and start digging into questions that you might have as an end user. And so you're going to find insights immediately. As soon as all that data is mapped in and we light up or we turn on the product, you get immediate views in your data to start making business decisions. And then most importantly, or not most importantly, but also very important, is self-service analytics. My team, I used to have, when I was at Blues, I had a ton of different SAS coders, SQL coders that were hitting up against the data warehouse, and they were the only ones that could go get the data. The goal of MedeAnalytics is that it's a easy-to-use interface. You don't have to know coding. The data has been cleaned and normalized and ready for end users, whether they're a C-suite person or they're an analyst, and that it can be served up to people across the organization. Now, also with that is it can be served up not just internally, but also externally. We have some clients that give their providers access, some clients that give their brokers access. So that's all set up through our very strong security settings on security groups. But it allows people to focus on what they need to be focused on and self-serve when they want to dig into those additional questions. Go ahead and go over to my last review slide, just at a high level, and then we'll jump into the demonstration. What I'm going to be showing you today, this is our entire payer solutions suite. There's multiple products you see there across the top, from healthcare economics all the way over to quality management. And the goal of this slide is just to let everybody know that we have a lot of different offerings to help support those needs. Sal's leveraging some of these. They're in the middle underneath the pictures of the views of each of the different products for the examples. There's a lot of different things that we can do, from enrollment to membership, looking at product design, looking at, what services our members or patients, depending on how you look, are using. With chronic condition analysis, total cost of care, we trend the data, we use risk scores. As I mentioned, you can get down into very minute patient detail if you've got that security access. So there's a really nice member profile that care managers and like nursing clinical folks like to use and look at the overview of the patients. Geospatial analytics, which is important. Sal was mentioning earlier about his PCP models and making sure, you've got the right product design that supports your provider network. Those are all things that can be done within these products. And again, just to reiterate, across the board, the lines of business, the areas that can help with this, we're not just a commercial plan, we help across those boards everywhere in the government entities as well. So I think now, without further ado, I want to go ahead and share my screen, and I'm going to sign into the products and just walk you through a few of these views. Unfortunately, I could talk about this stuff all day. I'm just going to show you some examples that tie back to what Sal was sharing earlier of how they leverage the tool. But just a really quick navigation of what MedeAnalytics looks like before I start showing you the end use cases. This is our landing page. This is what it looks like when you sign into MedeAnalytics. This black bar here is our navigation bar. This gives access to a ton of predefined reports. Now, the important thing about these predefined reports, when I talked earlier that our clients have given us feedback, these are the things that we've heard from clients are things that they tend to routinely look at. These standard reports are just to get you started, and I'm actually going to show you a few of these here in just a moment. But hopefully you can see the point of this is when you sign on as an end user of MedeAnalytics after the implementation has happened, we've mapped the data and done all of that heavy lifting on the data side. The first time you sign in here as an end user, you can start looking at reports that are available that get you started into the discussions. We also, as I mentioned, you don't have to sign in and out of products. So we have a product picker. If you purchase multiple products from us, you don't have to sign out of this one and go sign into another one. So I'm moving from our healthcare economics view right here quickly into our value-based performance management product, which is population health and quality. And not sure if you caught it, but there's a different view of standard reports up here now. I have different views available. It's all smart behind the scenes to know what's automatically out of the box tied with each of the products. So I'm going to spend a little bit of time here in this view in the value-based to tie back to Sal's discussion about evaluating the clinical, the risks, and just overall costs associated with the population. The first thing, I'm just going to go into a few dashboards to show you the concepts there. I'm going to start with, let's look at from a cost perspective. And maybe your question is, I need to find out what's driving costs. Is it inpatient, outpatient? Is it pharmaceutical costs? What is it that might be driving it? So out of the box comes this particular dashboard. As an end user, I didn't have to go in and develop this. We've already got the view developed for you, and it will probably at least give you, 80% of the answers that you might be interested in. I can quickly look at the overall trends for all of the different PMPMs across the board. But you also notice we have the ability, this view is comparing accounts to a benchmark. So if I have a category that I want to evaluate, in this case, maybe I'm producing a report for one of my clients as an employer health plan, and they're interested in, how are their inpatient PMPM spend compared to, all of the other clients. And so I'm just going to go in here and show you, hopefully you can see how easy it is to point and click. I don't have to know SQL coding. I say I want to go in and identify, what accounts include. I can select the values and it gives me the listing of what's available to slice and dice the data on. I'm just going to select one of these accounts and apply it. And now when I update that, all of the widgets on this page are updating to show me for account 2, what is their view of trend versus the rest of the accounts that I have access to. So you're going to see these adjusting here. And hopefully now, this can provide a conversation or an analysis, whether it's the account you're slicing and dicing it by. I'll show you here in a moment how you can look at this by chronic conditions and look at, your diabetic population and look at costs and trend drivers. But the important thing is we have visual concepts that can help you quickly identify, well, there's something that's different here in this account. There was more spend in the month of November than there was for the benchmark cohort. So, again, immediately you can start looking at just one example of one dashboard and start looking at your trends and spend across inpatient, outpatient, professional, and pharmacy costs. Another view that I want to show you, I just moved over to inpatient, so you can see it breaks it down a little bit more in the inpatient metrics. Now it's paid per admission, average length of stay, admits per 1,000, days per 1,000, and so on and so forth. Anywhere that you see a drop-down arrow within MedeAnalytics, that means there's something else you can do, and I'm going to go into that here in another view. But just note that the concept of these dashboards is that it gets you started in analysis, but you can drill down from here and continue to deep dive into your data. Another view, as Sal was mentioning, is understanding the risk of your population. So I'm going to bring up our predefined standard template of patient risk dashboards. And this is going to give me an overview of, what is my population and what are their chronic conditions that they have? metrics specifically around, do I have a frailty, percent of frail population that I need to be worrying about? And then what we use for a risk stratification methodology is ACGs. It's a Johns Hopkins methodology. And it helps identify the spectrum of low risk patients all the way to catastrophic. And again, the nice thing with the tool now is all this data has been fed in. I didn't have to do any coding to get this data in this dashboard. And now if I want to start doing more deeper dive analysis, I can select just this diabetes. Maybe I'm interested in having these widgets over here update for just diabetics. So I'm going to select diabetes. And now my data is going to change and give me information specifically about my diabetics. And our moderate population, the pie grew, right? And that makes sense. You've got the diabetics who are on the end of pre-diabetes to the very high complicated, probably comorbid diseases with diabetes along with that. So at any time, these dashboards are dynamic and that I can drill down in. So if I really want to only focus on these moderate population and figure out who are my patients in here, now I'm moving from an end user persona of somebody just interested in the high level metrics to see what's going on to I want to take action. I want to find out who these people are and then, identify more information about them. So maybe I can tie them with a care management program, so on and so forth. So I'm just going to click on this pie chart and I'm going to drill down. And what it's going to do is open up a new page that it takes me down to a summary that says, okay, there was 2,953 moderate people that you just selected on that chart. I can add additional fields here. Right now, it's just showing me the moderates. I can add fields to start looking at different sets of population and really drill down on my report here. Or I can, again, drill down and I say, I want to know more about these 2,900 people. Show me the listing of these people. And now it takes it down to the details. So I've just shown you, the major structure of MedeAnalytics going from dashboards to summary, where it's still aggregated data, but a little bit more detail, down to the raw detail about the patient population that made up that 2,900 diabetic population. So this has a ton, and this is all the identified data. Don't worry with the number information popping up here. It's a ton of information. And, it can maybe seem overwhelming, but you always have the opportunity to continue to analyze and filter and focus on certain areas. So let's say there's, maybe I only want to focus for these diabetics on people who have had, a high number of emergency room visits, for example. I can start looking through the different fields that are available for me to slice and dice the data on. And what I'm going to do is add a condition in here to identify ER visits that are greater than or equal to 3. Just as an example, I'm going to update the data. And now it's going to focus on that patient population. There's, again, a ton more you can do with this and start drilling down into were those emergency room visits preventable or non-emergent or emergent, and really focusing in. So in this case, you can see there was 83 different different members who had 3 or more emergency room visits. And so here's the examples. You can see that it changed and slimmed my data down. So there's about 6 million rows of data in this demo database. And you can see, we very quickly are starting to analyze the data and come up with key questions. With these emergency room visits, maybe I want to now take this and, again, from the actionable standpoint, I want a care manager or I want somebody to really focus on these people. And are they ER frequent flyers or are they just somebody who's got, some crazy stuff going on? So we can leverage the patient profile in that aspect. It just takes this data of all of these columns across and puts it more into a consumable view of the data. So I'm going to open this up and you can see here, it's got the member that I chose, it's got their demographics. But now I can look at this and say, okay, I know they have 3 emergency room visits. Now I can start looking at risk probability. Are they going to continue to have hospitalizations? Are they going to have a high cost range and somebody that I need to focus on? They had 3 ER visits, but they're having a lot of outpatient services, and they have 6 chronic conditions. So to the point of focusing on the right patient at the right time and prioritizing your patients, this is probably a good patient that we need to assess. As you can see up here at the top, there's much more information. And again, this is all being served up from all that underlying data. We help you, I'll say, data wrangle and clean at the beginning. We can start looking at medical utilization markers, medications that they're taking, and look at the brand versus generic utilization. And then we get back into those 6 chronic conditions for this particular person. So if I'm going to talk to this person, if I have an opportunity to not just talk about diabetes and I'm going to care manage or try to, do an intervention, let's look at everything that's impacting this patient. And then we get into gaps in care, which I'm going to also dive into a little bit more here in just a second, on some different views of gaps in care to identify opportunities for the patients on areas that we may need to focus on. So just want to pop in one more view just to show you that gaps in care aspect and quality measures, and then I'm going to open it up for any questions. And I know I'm moving fast. Again, as Sal was mentioning, we have HEDIS scores, we have preset dashboards, we have STARS ratings, preset dashboards for Medicare. And the important thing with any of these is you don't just have to use these dashboards. These are all customizable. We give you something to start with as a template, and then you can make changes and edit these and save them as your own. You can, change the graphs, the charts. All of it is flexible to be customized to your needs as an end user.